Wonderful to see you all here this morning, and this is a very happy occasion. It is wonderful to be with so many colleagues from the State Department, from across our government, both here, online, in Washington, around the world. On my first day in this job, I committed to build a State Department that is ready to meet the tests of the 21st century and to deliver on the global issues that matter most to the lives and livelihoods of our fellow citizens. Since then, we have taken a number of significant steps to modernize the department so that we can better tackle the climate crisis, cybersecurity, digital policy, critical and emerging technologies. And that's why, as another critical part of our modernization agenda, we're here together today to launch the Bureau of Global Health Security and Diplomacy. We all know from the COVID-19 pandemic what a profound threat a public health emergency poses to every aspect of our lives. It took the lives of millions of people, upended those of hundreds of millions more, devastated communities and economies around the world. Indeed, the last few years have made evident that a pandemic is not only a health crisis, it's a security crisis, it's an economic crisis, it's a humanitarian crisis. We have an imperative to do everything that we can to prevent another pandemic. And when the next health threat emerges, and it's not a question of when, or it's not a question of if, excuse me, it's a question of when, we have to be ready. And the world at large has to be ready. That is a central mission of the new Bureau, to leverage the full power and purpose of American diplomacy, to bring the world together, to prevent, and if that doesn't work, to prepare for and respond to the next health disaster. We're setting up a new Bureau to focus fully on the need to drive both internal and international coordination and accelerate the State Department's ongoing efforts to strengthen global health security so that the world can respond with immediacy and intention when the next health crisis emerges. And that's where diplomacy comes in. Today's launch reflects the vision and the hard work of so many people in this room and a lot of people outside of it. And just to name a few of them. First, congressional leaders on both sides of the aisle, longtime champions of our health diplomacy, especially Chairman Menendez, Ranking Member Risch, Senators Coons and Graham, Chairman McFaul, Chairman Diaz-Balart, Ranking Member Meeks, Ranking Member Lee. We are grateful for their engagement, for their leadership, for their partnership on this. Here in the department, Deputy Secretary of State Verma, former deputies, Wendy Sherman, Brian McKeon, so many from across the department who, as a team, guided the creation of this Bureau from idea to implementation. And I've got to say, by Washington standards, we were just talking about this, warp speed. Secretary Becerra, Administrator Power, two great friends and colleagues, the invaluable work of the Department of Health and Human Services and USAID to promote the health and well-being of Americans and of people around the world, and a close partnership throughout with the State Department. We couldn't be more grateful for that and for your presence here today. This Bureau, while new, builds on decades of leadership on global health by the State Department. We've worked alongside our colleagues from USAID, from HHS, from the CDC, and through our embassies and consulates to protect people against and to work to eradicate diseases like malaria, tuberculosis, cholera. Those efforts over the years have literally saved millions of lives. But we've led on responding to international outbreaks, working with countries around the world to combat the 2009 swine flu pandemic, to counter the largest Ebola outbreak in history in 2014, and to slow the spread of Zika in 2015. And last year, we mobilized a global coalition of 32 countries, the European Union, the African Union, the World Health Organization, along with civil society and the private sector, to help lead the world out of the acute phase of the COVID-19 pandemic. In total, the United States has donated over 688 million vaccines, safe and effective vaccines, free of charge, no strings attached, in partnership with COVAX and others to 117 countries around the world. And then, of course, there's the work of the United States and all of us here in terms of the Transformational Foreign Assistance Initiative, PEPFAR. This program, created by President Bush and his administration, sustained through 4 administrations, through 10 Congresses, drawing on every part of the United States government, has directly saved more than 25 million lives, and also set up a health infrastructure that's been vital for combating not only HIV/AIDS, but also Ebola, the avian flu, and COVID-19. That includes surveillance systems to help track outbreaks, laboratories to run diagnostic tests, supply chains to transport medicines, healthcare workers to administer those medicines. We're focused on reaching the United Nations goal of ending the HIV/AIDS pandemic by the year 2030. I know the congressional leaders who are with us and who are engaged in this effort, all of us today share that goal, and I look forward to working with our colleagues in Congress in the days ahead to secure a clean 5-year reauthorization for the program before it ends in September. With PEPFAR continuing its work as part of this Bureau, we will be very well positioned to apply its many lessons, as well as those learned from countering other infectious diseases over the years, to deliver on our other global health priorities. Our investment in global health has shown the good that the United States can do globally while safeguarding the well-being of our own people. It embodies the very best of American innovation, scientific excellence, capacity to work in partnership with other nations in service of shared goals. This Bureau is especially well poised to succeed because we happen to have one of the brightest, most experienced minds in global public health leading the way. Ambassador Nkengasong has 3 decades of experience countering HIV/AIDS in the lab at the U.S. Centers for Disease Control and Prevention, at the Africa CDC, and over the past year here at the State Department. He's devoted a lifetime to strengthening global health security. He understands the importance of American diplomacy in rallying the world around this urgent issue. And that's why we've asked him to head up the new Bureau, even as he continues his service as our Global AIDS Coordinator. Overall, the Bureau of Global Health Security and Diplomacy has 3 main functions, and let me very quickly go through them. First, to lead the United States diplomacy in strengthening the global health security architecture so that the world is better prepared to prevent, to detect, to control, to respond to infectious diseases. That includes by working with partners to modernize existing organizations like the World Health Organization so that they're more fit for purpose, and by shaping new structures like the Pandemic Fund. Second, to help leverage U.S. foreign assistance to strengthen public health systems, including labs and supply chains for vital medical countermeasures, so that we're better able to address current and future health threats alongside our national, regional, and multilateral partners. And third, to elevate health security as a core U.S. foreign policy priority through both our diplomatic engagements around the world and through our role in health security policymaking across the United States government. The Bureau of Global Health Security and Diplomacy will lead the department's work on these priorities, while also supporting other offices in the building that work on related but distinct public health issues. Strengthening global health security is and will continue to be a priority for the Department of State. With this Bureau, we'll be better positioned to share information across the building, trade lessons learned with partners, and ultimately drive action and forge a safer, more secure future for our fellow citizens and for people around the world. So that, in a nutshell, is why this is such a good day and an important day, to see this idea turn into reality, to see everyone in this room and joining us online who's been a part of this effort, and now to be able to launch what for me is a truly exciting initiative for the future of this department and for the future of our interests. That makes it a good day. And I really want to thank all of you for your partnership that brought us to this day, but also for the partnership that's going to be so necessary in the days ahead to make this work, to make this a reality that actually has an impact. I can't think of a more important endeavor at a more critical time. And with that, it is my great pleasure to welcome the Administrator of the U.S. Agency for International Development, Samantha Power. Sam.